Welcome back. This is Faustina Gomez from WHO's Southeast Asia Regional Office again. In Module 8, we'll explore safely managed sanitation in healthcare facilities. After completing this module, you'll understand the minimum standards required for sanitation in healthcare facilities. We will look at the interconnections between antimicrobial resistance and sanitation and cover strategies to mitigate this critical issue. We'll explore a range of sanitation technology options and learn methods to enhance user friendliness, gender inclusivity, and climate resilience in sanitation facilities. Sanitation is a fundamental human right and central to promoting dignity and well-being. Shockingly, however, the latest data published in 2023 by the WHO UNICEF Joint Monitoring Programme for Water Supply, Sanitation and Hygiene (JMP) reveals that 1 in 10 healthcare facilities worldwide lacks any sanitation service. This not only undermines the health and dignity of staff and patients, but also discourages women from delivering in healthcare settings. The right to sanitation extends to protection against the adverse effects of unsanitary conditions, such as the leakage of excreta, contaminating the environment, which is of particular concern in healthcare facilities where wastewater and fecal sludge are more likely to carry high concentrations of pathogens, including drug-resistant bacteria. Sanitation services must cater to the physical and cultural needs of all users. This means accessibility, privacy, and adherence to culturally specific practices of anal cleansing. Human feces, a primary source of microbial pathogens with more than 1 billion pathogens per gram, pose a significant risk. Diseases such as cholera, which can rapidly spread through the feces of infected individuals, alongside vector-borne diseases like lymphatic filariasis, West Nile virus, malaria, Zika, and neglected tropical diseases such as helminth infections and schistosomiasis underscore the need for improved sanitation to prevent the spread of infectious diseases. So what are the minimum requirements for sanitation in a healthcare facility? Toilets should be on-site, accessible and usable. They should offer privacy, having a door that is unlocked when not in use or for which a key is available and can be locked from the inside during use. There should be no major holes in the structure. The hole or pit should not be blocked. Water should be available for pour-flush toilets, and there should be no cracks or leaks in the toilet structure. It should be within the grounds of the facility and clean, as noted by the absence of waste, visible dirt, excreta, and insects. Facilities should be gender separated or provide privacy if gender neutral, include options for limited mobility, and support menstrual hygiene management needs. Toilets should have hand washing stations with water and soap rather than alcohol-based hand rub, which does not remove fecal matter from hands. How many toilets and showers are required in healthcare facilities? The minimum number of facilities is 2, which is considered realistic even for very small healthcare facilities. For larger facilities, more toilets should be available. For inpatients, there should be 1 toilet per 20 users. For outpatients, a minimum of 2 toilets is required, 1 for staff and 1 for patients. Ideally, and where possible, there should be 4, 2 for staff separated by gender and 2 for patients separated by gender. At least 1 should be accessible to those with limited mobility. Sanitation is a crucial barrier against the transmission of pathogens associated with excreta. This is the fecal diagram, also known as the F diagram, which clearly shows fecal-oral disease transmission routes. It illustrates how failure at one point along the sanitation chain can lead to disease transmission. Feces, which are not disposed or stored safely, represent a health risk for humans, since pathogens in feces can be transmitted to humans by flies, contaminated foods, unwashed hands, and through crops and fluids, including water. Unsafe sanitation leads to infections, developmental issues, and broader well-being impacts. For a detailed list of outcomes, see Table 1.1 in WHO's Guidelines on Sanitation and Health. Antimicrobials, including antibiotics, antivirals, antifungals, and antiparasitics, are medicines used to prevent and treat infectious diseases in humans, animals, and plants. Antimicrobial resistance, or AMR, occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial medicines. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infections become difficult or impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. Inadequate access to sanitation in healthcare facilities can increase the risk of AMR. Wastewater originating from healthcare facilities often contains elevated levels of resistant bacteria and residues from antimicrobials, including those considered last-line defenses. So what can be done? The priority should be the safe collection, storage, and treatment of wastewater and sludge, either on-site or off-site. Treatment systems must effectively remove AMR-resistant bacteria at rates comparable to other bacteria, thus reducing the risk of transmission through wastewater and sludge. Secondary treatment is generally considered sufficient, but higher levels of treatment may provide additional protection. In addition to safe sanitation, facilities should also implement drinking water treatment methods such as filtration or chlorination to reduce waterborne diarrhea, thereby minimizing the need for antibiotics due to waterborne illnesses. And finally, practice stringent infection prevention and control measures, including thorough hand hygiene protocols. To learn more about AMR in healthcare facilities, take the Open WHO course, Antimicrobial Resistance, AMR in the Environment, Key Concepts and Interventions. We will now look at some sanitation technologies, starting with toilets and moving on to on-site and off-site treatment options. Toilet designs must match local conditions, including water availability, waste management, and personal hygiene practices, while being accessible and affordable to all. Features should include durability, hygiene, and protection from stormwater. Safety and usability enhancements may include sex-separated facilities, locks, lighting, and disability access. Pour-flush toilet devices are readily available and their use is encouraged where there is any source of water. Biogas reactors offer waste treatment with energy recovery but require regular maintenance and a market for the gas. Sanitation systems can be broadly categorized into on-site and off-site systems. On-site treatment involves the collection, storage, and treatment of excreta, referred to as fecal sludge, directly into the plot where they are generated. In rural primary care facilities with ample space, few patients, and limited resources, a single ventilated pit latrine may be the most suitable option. The latrine must be up-gradient and at a safe distance over 15 meters from any water source. Once the pit is filled, it must be safely emptied and the waste should be taken off-site for further treatment or covered, and a new pit should be dug. Off-site sanitation involves collecting and transporting excreta or wastewater away from its source. This is often done through sewer technologies, utilizing manual or motorized methods for removing fecal sludge from facilities. Motorized transport using vehicles with pumps and storage tanks is common for wet systems like septic tanks. However, access to toilets can be challenging, especially in urban areas. Sewer-based systems, including gravity, simplified, and solids-free sewers, transport waste to treatment facilities. While gravity sewers are prevalent in high-income countries, low and middle-income countries often lack adequate sewage infrastructure. Healthcare facility managers and a washpit team can advocate for improved sewage systems. Alternative treatment options include waste stabilization ponds for warm climates and anaerobic filters for more sophisticated treatment. Further details on off-site sanitation options are available in the module resources. With all these technologies, sanitation workers face high risks, often working in confined and hazardous environments where they encounter infectious diseases and harmful chemicals. Safety measures, rigorous protocols, training, and appropriate protective gear are essential to mitigate these risks. The WHO guidelines on sanitation and health include 11 sanitation system fact sheets and inspection forms. These are short, standardized observation checklists that can be used to assess risk factors at or near sanitation facilities and identify appropriate remedial actions to safeguard public health. The fact sheets cover applicability, design considerations, operation and maintenance, and measures to protect public health. They are accompanied by sanitary inspection forms and management advice sheets. They can be used as part of routine washpit assessments for those that want to look at sanitation systems in more detail. We will now look at the impact of climate change on sanitation. Pause the video and take a minute to look at the pictures and consider what the impact could be on sanitation systems. Climate impacts on sanitation are varied and severe. Intense weather events including heavy rainfall, floods, and landslides often lead to the destruction of sanitation facilities, spilling and overflowing of waste, resulting in significant environmental contamination. Persistent droughts cause a decline in water availability, affecting the functionality of water-dependent sanitation systems like flush toilets. High temperatures and heat waves exacerbate these issues, leading to the malfunction of sanitation systems and increasing odors, which deter use. Climate-resilient sanitation infrastructure is more important than ever. So, what can you do to improve resiliency? Locate toilets away from flood-prone or erosion-prone areas at least 15 meters from water sources and above the water table to prevent contamination. In disaster-prone regions, choose raised or enclosed toilets that are easily emptied. In water-scarce or flood-prone areas, opt for low-water or waterless toilet systems like urine-diverting dry toilets. Empty septic tanks before flood-prone seasons to prevent overflow and restrict access to flood-exposed areas. Finally, maintain hygiene standards through regular, more frequent cleaning during periods of heightened risk like cholera outbreaks. Sanitation services pose unique challenges for children, older people, pregnant women, and women in labor, individuals with disabilities, post-surgery patients, women and girls, and indigenous communities. Common issues arise from the design and location of facilities. 4 examples are presented here. Take a moment to think, have you ever faced problems accessing sanitation facilities? How did this make you feel? You can refer to the WashPit indicators for further guidance on improving accessibility of toilets, including specifications of toilets, access paths, measurements for sinks, taps, doors, and hand washing stations that accommodate wheelchair users and those with disabilities. More information on accessibility is provided in the JETC module of this course. Unclean toilets and bathrooms pose significant health risks, inviting disease-causing organisms and deterring proper use. Regular spot checks, cleaning, and provision of personal protective equipment to cleaning staff will help keep toilets clean. We will go into more details on cleaning requirements in Module 11. Toilet side sprays, a popular feature in many cultures, should be removed or thoroughly cleaned after every use. Side sprays are an obvious source of person-to-person fecal contamination, as discussed previously in this module. Essential hygiene products like anal cleansing materials and soap for hand washing should be regularly replenished. For dry toilets, ensure a ready supply of materials like ash or sawdust for covering feces, preventing flies and odors. Plumbing is needed to maintain sanitation systems, especially septic systems. Specific plumbing tasks include regularly emptying sludge to ensure efficient operation, preventing pooling water and avoiding discharge to open ground or drains to safeguard environmental health. There should also be adequate setback distances from on-site water sources and appropriate sewer connections to prevent contamination. It's crucial to check for leaks and overflows, ensuring that solids and liquids are conveyed to treatment facilities or sewers without compromising hygiene. Discussions with authorities and downstream assessments will be necessary to confirm that sewers lead to safely managed treatment plants, preventing septic effluent from flowing into community drains or water sources. These measures ensure that effective functioning of septic systems, minimizing health risks, and promoting environmental sustainability in sanitation practices. The technical fact sheet on safe plumbing for wash services provides some examples of suggested plumbing improvements and plumbing considerations throughout the WashWith cycle. Thank you for completing this module. Here are the key points. Sanitation facilities must be accessible to all, prevent infection spread, and uphold every user's dignity and well-being. A clean operational toilet is crucial, but it's equally important to ensure fecal waste is safely collected, transported, treated, and disposed of. Regularly cleaning and maintaining toilet facilities is a cost-effective way to mitigate risks associated with fecal waste. The spread of antimicrobial resistance can be curtailed through well-managed sanitation systems and the safe disposal of pharmaceuticals without the need for expensive high-tech solutions. Please refer to the reference section of this module to access links to all mentioned resources.